COVID-19 screening testing for students, faculty, and staff. Right now, our district is focused on risk mitigation in order to prevent transmission within our school buildings. The current pillars of health practices that we are following: social distancing, mask wearing, hand washing, symptom screening, and disinfecting and cleaning. Our goal now is to add a sixth pillar of risk mitigation, which is COVID-19 screening testing for students, faculty, and staff. Why do we want to embark on COVID-19 screening testing? Because we want to better understand the impact of COVID-19 within our school community. We want to improve confidence, as this will identify and isolate asymptomatic carriers. We know that 50% of transmissions of COVID-19 come from people without symptoms at the time that they transmit. This will also allow us to make fact-based decisions about opening and closing schools or the entire district. But most importantly, it will help us achieve our long-term goals, which is to sustain in-person learning and to provide a path toward increased in-person experiences for students. Screening protocols have been widely implemented in many colleges and universities. Many K-12 private schools in Massachusetts have also begun the screening process. K-12 public schools have had fewer resources to support screening, but many districts are now starting to pilot this. Our district is part of the Safer Teachers, Safer Students Collaborative, which includes a number of districts in the state. Wellesley and Watertown have started the process of screening students and staff. Cambridge has started the process of screening staff. Public schools in New York City are screening a subset of students and their staff, and various screening protocols are being looked at across the country, such as in Colorado, Arizona, and Nebraska, with a mix of students, staff, and both. What we know is that computer models show us, by simulating COVID transmission in schools, that weekly screening could permit full-time, 5-day school at a total infection risk that is similar to 2-day hybrid learning without screening, especially where community rates are moderate or high. There are various types of testing programs that are out there. One of them is pool testing. So I'd like to talk a little bit about that. In pool testing, samples are received from all members of a pool and combined in the lab and tested together. If the test results for the pool are negative, everyone in the pool is negative at the time of that test. However, if the test result for the pool are positive, then at least one member of that pool is positive. Then individual samples would be tested to identify positive members of the pool. This can be done by using the same sample that was part of the original pool without having to return for another test. This actually is a way to reduce costs because fewer total tests are needed. Additional information about characteristics that we are looking for testing programs. Testing should occur on a regular basis, weekly, approximately 25 times over the 2020-2021 school year in our district. If we embarked on this, test results are reported within 24 to 48 hours. The test will be a PCR test that is lab-based for highest accuracy. What will need to be determined, and this will depend on our vendor, is the collecting site, whether this can be done at home or at school. What we will also need to look at is how the specimen is obtained, whether it will be a swab of the anterior nares or whether it will be a sample of saliva. What none of these tests will entail is the deep nasopharyngeal swab that we've all heard about. Potential cost. So there is a cost associated to screening, obviously. If we were to embark on 25 testing events and start with our high school and all of our faculty and staff across the district and use a rate of about $15 per person, which is one of the lowest prices out there, this would be pool testing. Our cost would be about $736,000, assuming that 90% of all people participate. The labs would reduce the individual sample size down to 2 if a pool test is positive. After that, the district would incur the cost of testing between those 2 people to determine which person is positive. So there is some available funding from both of our towns through the CARES Act, and our next goal will be to explore potential partnerships to support this program to help make up the remainder of the cost. We are planning to move forward with an invitation to bid to ensure compliance with state procurement rules. Before I end, I'd like to thank the Medway Public Schools and other members of the Safe Teachers, Safer Students Collaborative for sharing all their experiences, and a special thanks to Dr. Andrea Saranello for assisting in this process, as well as Superintendent Martineau and Mary Ellen Duggan. Thank you.